Who can? बस इतना हाँ बस इतना मनाने को जो बेटा वीडियो आ रहा है वीडियो भले आना चाहिए अरे वो वीडियो हेडफोन कौन है नहीं मैं डायरेक्ट लैपटॉप में अच्छा ओके बता आपको वीडियो होना है अस्सलाम वालेकुम ठीक है अरे ये तो मैं बोलूँ नहीं हाँ ओके ठीक है अस्सलाम वालेकुम good morning I'm Dr. Naseer Memon today we will discuss on the typhoid fever enteric fever you listening the voice clear
yes sir
okay thank you we all know I think you are familiar with the more typhoid enteric fever this lecture today will be just a revision because in everybody in any stage or in past have developed the typhoid if not developed in the family anybody have come across a typhoid enteric fever patient in the house so we know that what is generally we know but we will today we will learn that what is the typhoid how we investigate what is the management and the complication of the typhoid fever so what is the typhoid fever enteric fever it is the bacterial disease caused by typhoid bacillus salmonella typhi characterized by prolonged high-grade fever, abdominal pain, diarrhea, rose spots, and splenomegaly. So it is the continuous high-grade fever which remain for the 5 to 7 days and associate with other symptoms. Like it can be cough, it can be abdominal pain, diarrhea, or sometimes examination you can found the hepatosplenomegaly or coated tongue. Then you label as a typhoid. Epidemiology is a very common disease. 21.7 million cases annually have reported in the world, of which majority cases are in the Asia. Over 2 lakh deaths annually have happened in the Asia. Population-based studies show that it's more common, highest in the children under 5 years of the age. You know that typhoid enteric fever cause is etiology is the Salmonella typhi. It's a gram-negative bacilli, and less severe disease can be caused by the Salmonella paratyphi A and paratyphi B and C. What is the Salmonella typhi? It is a motile, non-sporulating, non-encapsulated that grow aerobically and are capable of facultative anaerobic growth. Salmonella typhi, they are resistant to the many physical agents but can be killed by heating up to 130 Fahrenheit for 1 hour or 140 Fahrenheit up to 15 minutes can be killed by. They remain viable in the ambient or reduced temperature for days and may survive for weeks in sewage, dried food stuff, farm agents and fecal material. So if we want to kill or save the prevention is that you have to boil the water or the uncooked things should not be taken and should be cooked. And what are the characteristics of Salmonella typhi? It's a gram-negative bacilli containing 3 types of the antigens. So O antigen, H antigen, and B antigen. You know that in the past, previously, the Vidal test was used. And that Vidal test was based on these antibodies. O antibody titer, if it is more than 320, then you say that the Vidal test is positive. But now we are not doing the Vidal test. Nowadays, it is not recommended because it's a non-specific test. So that Vidal test was based off these antigens, O, H, and the via antigen. What is the pathophysiology? How that disease enteric fever happen? When we ingest the organism, what happened with that organism? After organism enters ingested contaminated material not destroyed by the gastric secretions, then bacilli invade the small intestine, terminal ileum, and traverse the intestinal lymphatic follicles, tear patches, and mesenteric nodes. What happened when it reaches the terminal ileum? It reaches tear patches, mesenteric lymph node. Its multiplication takes place in the mononuclear cell. The organism not destroyed by monocyte reach the liver, spleen, bone marrow, and then secondary bacteremia. At the end of incubation period, they pass the bloodstream and produce bacteremia, which causes issue symptoms of enteric fever. Prolonged fever, toxic symptoms are produced by circulating endotoxin and endotoxin-induced cytokines produced by the macrophages. This is the diagrammatic presentation. If you look for when this Salmonella typhi ingested in the intestine, it reaches to the terminal ileum, where terminal ileum there is a M cells. This is the M cell where Salmonella typhi is attached. From here, intestine terminal ileum, there is a M cells. From this, it cross and it reaches the Pierre Pages and reaction by the macrophages. From here, it reaches to the mesenteric lymph node. From mesenteric lymph nodes, it travels into the blood. From here, it develops the primary bacteremia. Here, it then crossed to reach to the reticuloendocrine system. What is the reticuloendocrine system? It's the liver, spleen, gallbladder, and the bone marrow. From the intestine to the mesenteric lymph nodes, then the blood, primary bacteremia. From blood, it reaches to the liver, spleen, gallbladder, and bone marrow. From here, then again come to the blood. It's a secondary bacteremia. From here, then again re-expose, again reach to the Pierre Pages and by the bile reach to the terminal ileum. So it's a vicious cycle is started, and till that we stop anywhere, then the symptoms will subside. Otherwise, it will be the patient will be sick and toxic and can develop the complications. So what is the mode of transmission? You know, it's a fecal-oral transmission. Anything contamination with the water, food ingested, and it lead to the typhoid fever. Through the contaminated food, water, incubation period is 7 to 14 days, ranges 3 to 30 days. What you said, 7 to 14 days. Like it's not that today you take in dirty water contaminated with the typhoid, salmonella. Are you eaten ice cream, or you have taken the any chart, and today you develop the typhoid? It's not. It takes 7 to 14 days. It's an incubation period after any dirty things in water, in the food, which is contaminated with the Salmonella typhi. You take in after 5 to 7 days that the sinus symptoms of the typhoid develop. And what is the clinical features? After incubation period, in the first week, you can get it the fever. Fever will be, temperature will be rise, will be stable latent pattern. It's like will be 100, then 101, 102, 103, 104, like that will be. Gradually it will be rising, stable latent pattern, but it not touch the baseline. There will be malaise, headache, non-specific symptoms will be there with the fever, anorexia, and alternate, it can be diarrhea or constipation. Some patients develop the diarrhea, some patients develop the constipation. Abdominal pain, tongue may be coated. These signs and symptoms you will get it in the first week of the presentation. Then what happened in the second week? Second week, the fever remained high, and then rose spots in 60% of patients in the abdomen, thorax. You can find the rose spots, and then later on, the patient, if untreated, can be drowsiness and spleen can be palpable. Then what happened in the third week? The third week of the week of the complications. Patient not diagnosed, untreated, are resistant to the drug, then that patient can go into the complication. What complication can be intense perforation, shock, ileus, and rigid abdomen. So all that complications of the abdomen patient can are sometimes the patient can land it in hospital with sick, with unconsciousness, with the complication of the abdominal complication like perforation, shock, abdomen rigid. What happened in the 4 weeks? Fourth week, like it's a restoration of symptoms, it should be treated properly. The symptoms will be resolved, and patient and the fever will subside, but there will be weight loss, there will be cachexia. Then after disease will be subside, then epidemic will come, and then weight gain will be started. But in the fourth week, all that fever, weight loss, and cachexia will be there. This is the study which show that it's a common clinical features in the 2,000 children in the Karachi. that they have seen that how many patient percentage of the confirmed typhoid fever will be sinus symptoms there. Like they have found what they have found that high grade fever is found in the 95% of the patients, coated tongue in the 76%, anorexia in 70%, vomiting in 39%, hepatomegaly in 37%, diarrhea in the 36%, toxicity in the 29%, abdominal pain 21%, pallor 20%, dyspnea 70%, then constipation, headache, jaundice in the 2% of the patient. The cause of the jaundice is in typhoid is not a hemolysis like in the malaria. Here the cause of the jaundice is the enteric hepatitis. That salmonella involved will develop the acute hepatitis in 2% of the patients. Then you found the jaundice. Obtundation, like there's a weakness of the body, drowsy, ileus 1%, and test perforation in the 0.5%. So if the proper diagnosis and treatment, very rare chances the patient develop the perforation or complications of the typhoid fever. These are the rose spots you found in the second and third weeks. It will found in the thorax and the abdomen. It's look like a mosquito bite, but if the fever with the coated tongue, and then you found if it is this look like a mosquito bite in the thorax and the abdomen, then you label as that this one is the this is the rose spots due to the typhoid fever. So how we diagnose the typhoid fever? There is some non-specific and there is some specific investigation. Non-specific that you have to go for the blood CP. Okay, you have to what things you have found in the blood CP. It will be normochromic, normocytic anemia, leukocyte count will be low related to fever. In other in other infections, you found the WBC will be high, but in the typhoid you will found that leukocyte count will be low as compared to the infection. So there will be leukopenia, neutropenia related to the fever, and sometimes you can found the thrombocytopenia. And if in the blood CP you found if there is a thrombocytopenia, it's indicate the severe disease. How that salmonella sometimes can cause to the bone marrow suppression. So here, otherwise you found the leukopenia, neutropenia. But when there will be bone marrow suppression, then you can found the thrombocytopenia. And if there is a thrombocytopenia, you must think for this is the indicate the severe disease in bone marrow involvement. What is the specific test? Specific test the blood culture. Gold is standard test for the typhoid is the blood culture. Other test is the Typhoid, IgM and IgG antibody test. This is the routinely we are going for because Typhoid you will get in few hours. You give the blood and in 1 to 2 hours antibody titer IgM and IgG. What is the interpretation of IgM and IgG? IgM show that this is the acute infection and IgG is show the chronic infection. Sometimes you can found the IgM and IgG, it show that the patient is in mid of the acute and the chronic. So both are the patient on the treatment, you will find the IgM and IgG. But otherwise, IgM, if it is only IgM is positive, it is to show the acute infection. And if there is only IgG, then this IgG antibody is show the chronic previous infection. Sometimes you have to go for the PCR, but routinely we are not going. The gold standard, always remember that gold standard for the typhoid is the blood culture. And blood culture and sometimes bone marrow culture, very rarely it's in the book written, but routinely it's invasive, so we are not going for. But you need to remember that the sensitivity and specificity of the bone marrow culture is very high other than the blood culture, but it's invasive. That's why we are not going for. But the blood culture positive, it shows that this is 100%, this is the typhoid. And Vidal test, sometime I said it is now not recommended. In previously, Vidal test was going for, it's showing 10 days to fifth week, it will be antibody titer against the O antigen. And second, you can go for a stool urine, but routinely, we are not going for the stool or urine culture. We are going for the blood culture. So for the diagnosis of typhoid, you can go for the blood culture, you can go for stool culture, urine culture, and the bone marrow culture. But recommended gold standard out of these all is the blood culture. Then come to the, when you diagnose the typhoid fever, then there is a treatment. So what is the treatment? One is the supportive treatment, other is the specific treatment. Supportive treatment is that adequate rest, hydration, correct fluid and electrolyte balance, antibiotics, and soft and easily digestible diet. Adequate rest. Yes, the patient is sick, toxic, not taking well, cachexia, loss of appetite, so patient is not in the good health, so it's better to rest them, not to go outside or not to do the work, or better to uh, give them the rest. Then hydration is important, very important. So if it is taking orally, then you have to give oral fluids, and sometimes if it is not intake good, then you can give the glucose also. But if it is not taking orally, or the patient develop the complication, abdominal complication, perforation, obstruction, ileus, or peritonitis, then you have to stop the oral intake and you have to switch to the fluid and electrolyte. If there is electrolyte balance is there, sometimes there is kalemia, hyponatremia, then we have to need to correct for that one. Otherwise, then maintenance fluid is given for few days, that patient appetite come back. But it is when patient is not taking orally, or patient is sick and develop the complication, abdominal complication, then important not to keep the patient at the home. Patient should be admitted in hospital. Otherwise, if it is taking orally and no need for IV fluid, then patient of the typhoid can be treated at the home. Antibiotics, you have to use the paracetamol 10 to 15 mg per kg 4 hourly. Antibiotics like paracetamol with the name of the Calpol, Panadol, Calpol 6 plus, Panadol 4, you can use this one. It depends upon the age and weight of the child. You have to decide for the antibiotic, and you have to continue for the 4 hourly. 6 times a day, 24 hours you have to give. If it is still fever, then you go for the sponging. Sponging your forehead, armpit, and the bathing is very good sponging for the child. When there is a high grade fever, 102, 103, 104, you have to bath the child, and in the 5 to 10 minutes, fever will be decreased. You have to use the antibiotic every 4 hourly, but with the bathing, if there is 103, 104, because you know very well that the children like between the 6 months to 5 years, 5 to 10% of the patients are risk for the febrile seizures. So we not wait for that for antibiotic to work for take, because you give the syrup antibiotic we will give, but it take time 30 minutes to 1 hour to effect to decrease the temperature. In this way, better you have to give the oral antibiotics, but simultaneously you have to go for the sponging or the bathing of the child with the normal tap water. In our mind, sometimes old concept is that you have to bathing by or the sponging with the cold water. No, we not use the cold water. You have to use the tap water, normal tap water that is coming with the that you have to use. Then regarding that soft and easily digestible diet, the child if it is not good, he is not able to take orally. But anything if we want to, you use better to soft diet, use the fruits, juices. It is recommended. When there is appetite, is there anything patient child can take orally? Like in our old concept that कि chapati is mamnu है, roti नहीं देनी है, और जो है वो मानी नायरियानी. This is not. ये पुराना तरीका होता था कि रोटी बंद कर दो. In the typhoid, there is nothing. Everything you can give. There is no contraindication. There is no absolute or relative contraindication for the diet. Anything, but the issue is that the child is not able to take. Is not able to take or digest it properly. That's why you have better to use the soft diet, fruit, juices, and if it is when after 4 to 5 days when you start eating, anything you can give. There's no contraindication for eating. Then specific treatment. When you diagnose, that you have to decide the patient is uncomplicated typhoid fever or severe typhoid fever. Uncomplicated means there's a you diagnose there's a typhoid, there's no complications, there's no vomiting, and patient can take orally. Then you have to decide that this typhoid fever patient can be kept at home. But second is that severe or complicated typhoid, when there is a complication, patient is not taking orally, then you have to, or there is a persistent vomiting, patient need the IV fluid, then you have to patient better to admit the patient and start the IV treatment. So there is a first line and second line treatment. First line, there was chloramphenicol, second choice ofloxacin, ciprofloxacin, amoxicillin previously was used, but then in previous years there is a multi-drug and extended drug resistant came, so that's why these drugs now it's not effective, like chloramphenicol, amoxicillin, and ciprofloxacin. There is high resistance. Only remaining cefixime also now there is a resistance. So in the oral now only remaining is the cefixime. Some sort of the sensitivity is there in few patients, but azithromycin is still they have a sensitivity. There is no resistance to the azithromycin. So oral, when we have a choice for the oral, then cefixime like cefispan you can use for 15 to 20 mg per kg per day for the 10 to 14 days, and then azithromycin 20 mg per kg per day OD for the 7 days. So these are the two drugs which can be used nowadays. Other than if it is resistant, then we have to switch to the ceftriaxone. Ceftriaxone IV can be keep if the patient is not toxic, no complications, and if we have a available of the blood culture, it is sensitive to the ceftriaxone, then we can start with the ceftriaxone. Then the patient who are admitted in the hospital are not able to take orally, or there's a abdominal complication, then we have to start with the ceftriaxone. Ciprofloxacin is another choice, but there is a high resistance to the ciprofloxacin. That's why we are not using. So there is a IV. There is a two choices: the ceftriaxone and the ciprofloxacin. Now, in the recently in last 6 months, there is a multi-drug resistant and extended drug resistant is there. So that's why now we are using, if the patient who are not responding on ceftriaxone are sick, toxic, then choice is the imipenem or the meropenem. These are very expensive drugs, and affordability is the issue. You cannot keep these patients at home when you want to start these very high antibiotics like meropenem or imipenem. This is the 100 meropenem dose 100 mg per kg per day for the 10 days. Then we have to discuss the general management specific regarding the antibiotics. Then in the lastly, there is a prevention. How you have to prevent the typhoid fever. Prevention is hand washing. We have to, like, now more and more people are we are talking on the coronavirus hand washings. It's a so for the all infectious, it's a viral or the bacterial, we have to hand washing. We can prevent for bacterial viral infection by the proper hand washing. When we are touching anything or coming at home, or when using the bathroom or cooking, then proper hand washing. We have to teach them, the children, that how you have to 20-second, 30-second, how you hand wash. Personal hygiene is very important regarding infection diseases. Proper disposal of strata. Unfortunately, in our country, this is very, very difficult. But yes, the government is doing properly, trying their best to dispose of strata, because there is a contamination. When there's a one side there is a gutter lines, another side there is a water supply lines. So when some side of then there is a breakage, there is a mixing of the water, and that water can contaminate it, and that drinking water can lead to the typhoid fever. Carrier should not be allowed to cook, like nobody know, like in when there's hostels or in the army camps, are some there where there's a cook is there. So it should be, if there is a more cases of the typhoid in the hostels or other places, there is a crowds, then should be identify that who's the carrier for typhoid. If there is a carrier, it can be transferred the typhoid to the others. Vaccine is almost is 100% prevention for the typhoid. There is a, you can use the TEP vaccine 0.25 ml subcutaneously. It can be used to 2 years. And after 6 years, there is oral vaccine Vivotef that can be used. Now, typhoid vaccine is included in the EPI. Before it was to purchase outside non-EPI vaccine, but now regarding that more and more cases of the typhoid, multi-drug and extended drug resistant in the Pakistan. That's why now WHO decided that typhoid vaccine should be included in the EPI. So it is started, it is given from the 9 months, 6 to 9 months typhoid vaccine. is included in EPI. And it can be like other outside when we would give the vaccine to the other children, it is for the 2 years. But this vaccine, which is included in the EPI, it's effective up to 10 years. No need to repeat the vaccine for up to 10 years. Then complications. Complications, if the untreated, undiagnosed patients who can develop the intestinal hemorrhage, intestinal perforation, or sometimes meningitis, patient can with the presentation and complication can come with the meningitis. Signs of meningitis will be positive. Patient can be neck pain is there. And enteric hepatitis, we discussed that 2% of the patient can develop the enteric hepatitis. Patient come with the jaundice and the tender hepatomegaly. Osteomyelitis, very rare complication. Enteric encephalopathy is also one of the rare complication. Patient come with the unconscious, drowsy, in the coma with the enteric fever. Myocarditis, yes, it's also rare complication, but we have to look for the end in the psychosis. Very rarely, 0.1% of the patients can develop this typhoid psychosis after the typhoid or during the typhoid. But we see very rarely, but few cases I have seen, yes, they have a sinus symptoms of the psychosis, but it is not permanent. With the passage of time, a patient when recover with the antibiotics, these sinus symptoms is subsided. Then come to last that when we think for any disease, always there is a differential diagnosis. So what is the different diagnosis with enteric fever? It's the malaria, UTI, acute appendicitis, leukemia. So how you have to differentiate the malaria with the typhoid fever? I said this in the typhoid will be continuous high grade fever, but in the malaria it will be episodic alternate day fever, and there will be anemia will be there. There will be a splenomegaly. In both you can find UTI with the differential. Yes, there will be sign symptoms of the UTI, like the patient have a lower abdominal pain, dysuria, there will be there, or lumbar pain in the right or left will be there. Regarding acute appendicitis, yes, it is also close differential, but it will be short history, fever, abdominal pain, vomiting, and the pain will be specific to the right iliac fossa. And then when you examine the patient, there will be tenderness in the right iliac fossa, and rebound tenderness will be there. Regarding the leukemia, yes, it is also close difference with the enteric fever. Here will be fever will be not subsided, and patient can be pale. Lymphadenopathy will be there, hepatosplenomegaly will be there, and bone pain can be there in the leukemia. In the last is not the that coronavirus also is the differential diagnosis to the enteric fever nowadays, because now there is overlapping in that fever. I said in the typhoid it will be 4 to 5 days continuous fever. Same in the this corona also, that's 3 to 4 5 days continuous fever is there. Or sometimes we diagnose this is the typhoid. There's a typhoid is positive, but later on turned to be with the typhoid there is a corona also. So when there is a fever, now we have to exclude the nowadays we have a pandemic of the coronavirus when the patient who is coming with the fever, loss of appetite, and there is loss of the smell, loss of the taste, or they have a diarrhea. Because in the pediatrics, not routine like in the adult, like fever, flu, cough, the patient will come with the corona. But in the pediatric, can come with the corona. Patient can with vomiting, diarrhea, abdominal pain, fever not subsided. And in the older child, yes, loss of smell, anorexia is there. So very close differential with the typhoid, malaria. Nowadays, we have to top priority. We have to exclude patient for the coronavirus also. So thanks. I have to complete my lecture. You have any question, you can ask for. You are welcome. You unmute your mic, please. Hello. Hello. Ji, one by one can ask the question. Hello. Yes. Any question? Hello. आवाज कौन बोल मां कई बता कोशिश की तव्हांजो आवाज़ कोन थो अचे मुंहिंजो त वञे पियो जेको मां साली मां खणी मोकिलिया थो फ्रेगमेंट सर नकरे माण्हू मोकिलिया थो ॿिए बि शो भेजियो आहे सकियो थो Okay, there is a question regarding typhoid vaccine. There is a tape vaccine which was available. It is given after 2 years. Okay, any question? Anybody can ask for any question? Okay, who want to question? Please unmute by yourself.
सर
जी
सर आपने बोला ना कि टाइफाइड जो है वो ईपीआई में
प्लीज
ऐड
लाउड
है। सर आपने कहा ना कि टाइफाइड की वैक्सीन ईपीआई में ऐड है, तो फिर वो प्रिवेलेंस क्या होता है हमारी सोसाइटी में?
जी जी वैक्सीन का क्या पूछ रहे थे आप?
सर मैंने कहा जैसे ईपीआई का पार्ट है तो ये 100% प्रिवेंटेबल होता है या फिर भी केसेस
प्लीज
होते हैं
वेट,
हमारी सोसाइटी में?
यू नॉट टॉकिंग लाउडली।
सर मैंने कहा कि ईपीआई के फिर भी कितने टाइफाइड के फिर भी कितने
Please, 1
केसेस
minute,
आते
please.
हैं?
Yeah, regarding vaccine, I said now in EPI vaccine is available. Before was not available in EPI, now is available. But anybody who want to purchase outside, that vaccine will be given after 2 years of the age, and every 3 years need to repeat. Okay, but the vaccine which is available in EPI, it can be given 6 to 9 months of the age, and there is no need to repeat up to 10 years of the age. This is the one thing. Second, that the protection of the vaccine is. Sorry, headphone की आवाज ठीक है, headphone लगा करो ना आपने. लगा ये पार्ट्स करो आवाज से चलो. Hello, जी, you listening, please?
Yes, sir.
Okay, okay. So what is another question? Because now mic is okay, you can ask for another question. Anybody? There is one question is clinically, how would we differentiate between COVID and typhoid according to symptoms before going for the test? Like the typhoid is the bacterial infection, and corona or COVID is the viral infection. Like in the bacterial, there will be fever, high grade, vomiting, abdominal pain, and continuous high grade fever. And in the COVID, yes, you will find the fever, vomiting, diarrhea. But body ache is that differential point, like body ache, very, very, very like जिस तरीके से हड्डियां टूट रही है, like that will be only will be in the COVID, but not in the typhoid. Initially, for few days, you cannot able to differentiate because there is a 50% sign symptoms are same, like fever, cough, and loss of the appetite, abdominal pain, diarrhea. This is all that one. But when there is a body ache is there, then you have to first suspect the COVID. You have to exclude the corona. Then you have to put the typhoid. Okay. Any other question? Okay. Thank you. I to stop here. If you have any still any question, you can ask. Thank you. I'm stopping here. Thank you all. Thank you. Thank you.
यार सब लीव कर दो, खत्म हो जाएगी खुद ही मीटिंग।
आवाज नहीं आए थे मेरे के परिणाम
उधर तो भाई जोर से लगा के आया
मुझे नमक की आवाज कौन रोते मां सब आवाज अच्छे तो करो तो दे मां ती हेडफोन मुझे अदर हेडफोन आए
हेडफोन लगो पे
मैंने पेरा कौन लगल
ना लगा लो सर
अरे पेरा कौन लगल
वो माई उठी वही ना मां तो कैसे आयो लगल हूं ना
पेरा
हाँ
कौन लगल
आयो